All right, so as we look at the skeletal system and bones as a storage unit for minerals, it actually becomes important then for maintaining homeostasis, particularly with calcium, because our bones have a lot of calcium. So we need calcium to help maintain the structure of bones. We actually need it in neuron cell communication in the nervous system. We need calcium to enable muscle contraction, and we need it for blood clotting as well as exocytosis of a variety of cells. And so calcium is a pretty big player in physiology. How we can utilize the bones as a storage unit, or kind of like the bank analogy as well, we can withdraw minerals when we need them, and we can put some back. And so calcium is one of those. We can take calcium out of our bones when we need it. About 18% of our calcium from the skeleton is exchanged with blood every year. So it's quite a bit. Our normal calcium concentration in blood is 9.2 to 10.4 milligrams per deciliter, which is quite a bit. When you are low on calcium, or there is a calcium deficiency, we call that hypocalcemia. And the result of this, or a symptom of this, is excessive excitability of the nervous system and the muscles. So when you're low in calcium, essentially your nervous system and your muscles over-respond or overreact to the presence of calcium because there's not a whole lot of it. When you have an excess of calcium, we call that hypercalcemia. And this results in the opposite symptom. The nerves and muscle cells are less excitable than normal because there's so much calcium around, then they're not as excited about it. Homeostasis of our calcium levels are going to depend on balancing several things. How much are you taking in your diet? How much is getting excreted through the urinary and intestinal systems? And how much exchange of your calcium is happening between the osseous tissues, the bone tissues. So we have to take into account all of these things going on at any given time. There are 3 hormones that will help regulate calcium levels: calcitriol, calcitonin, and parathyroid hormone. And we'll talk briefly about each one.